the emphasis that when we're talking about measurement and using measurement to support your improvement initiatives, here there's two levels of measurements. There's one that we use with the projects, the quality improvement project, where patients are involved. Okay, you want to demonstrate that the project works, but you need an whole set of different measures for when you are in your organization that you want to deploy this strategy to make sure that this strategy works. Okay, and I'm just going to give you a few examples of what we have used here until now. Okay, so when you're talking about using measures to know if your project works, in this particular project, it was the phone access. Okay, patients had problems to get through just talking to a human being. Okay, so we tried to improve that, and we used standardized survey. But you soon realize that now the objectives pursued are so precise that no standardized survey will never work. So you have to adapt your measurement. In this project, we use patients calling patients. So what do you think now? Okay, is it better? And have the patient report to the team their findings. Okay, so this is so powerful. It's so easy. We made 15 calls and it worked very well. Okay, so it doesn't take much. So you need those measures, but you also need, just tell you that our project worked. We did improve, by the way. Okay, so that was like 60% of our patients that call the clinic says they always got the help they needed when they called. Okay, our goal was to reach the 60% mark, and in January we want to get the 70% mark. So it's a continuous improvement work, but we're making progress. So this is a quality improvement project. But on the side, all the training that we want to put in place, the recruitment process, does it work? How do we know if it works? So this requires a little bit more standardized measures. So the one that we used was the capacity to partners. It's an RHQ tool that we modified with Marie-Pascale. We use team effectiveness to know if they gain the QI skills required to make changes. And we use also psychological empowerment scale. So this is to know is our program working or not. So the training we offered, we did 4 different trainings. We tried different ways. And we had measures, and we see that we improve over time the way we were delivering the training. So this was useful. It's easy to do and doesn't take much time. Then the Agency for Healthcare Research and Quality tool that we use, we had to modify it because it was too basic. And we did learn a few things with it. Those are a few questions that we ask. The first one, I believe that my organization actually supports patient partnership. So we ask the professionals, the patients in those quality improvement teams, do you feel the support? So you got the pre and post, so it works. We did quite a good improvement in this. But what is interesting is that if you look at the question 8 and 7, we didn't make any progress on this. I am comfortable requesting that the patient and family advisor be invited to participate in improvement initiatives. And those are people that did participate in those quality improvement with patients. And after going through that exercise, they're still not like the how to do it. Now they believe in it, okay? They strongly believe in it, but the how is not there yet, okay? And same thing, I consistently let colleagues know that I value the insight of patient and family advisors. So, they do the value, because the last one, I believe the importance of patients. So, they believe in it. It makes a big difference when you put patients there. After they did it, they really believe in it. But the how to do it, it's not, we still have to help them. So we did learn a few things with this. But those are only quantitative data. And when you need to spread this across an organization, I think the qualitative speaks a lot more. Okay, and we know that with these quotes that bring Marie-Jo, bring Emmanuel to like senior executive meetings, talking about it, it's a lot more powerful than the numbers. But you still need the numbers to know if it works or not. And then this tool that we use, it's the one by Shortnail. It's to see if they got the QI skills to do another project. This one is very funny because when you introduce patients in the team, that means the team wasn't there before. So you ask question, is your team working well? But the team didn't exist. So how can you do a pre and post on a team functioning if the team works well when the team is not really a team to start with? So I didn't like that one. Okay, but it's funny. So what did we learn? So when you measures for improvement, if your project works, you need some flexibility. You need to involve your patients in measurement, and the measurement needs to be driven by the team. So, and when you measure for accountability for spread, qualitative data is a must. The readiness for partner, I think I'm going to use it again, okay, because there's something to learn from it. But I'm still looking for a good tool to know if the people in the team got the QI skills, okay, that we try to give them. So that's about it.